Today, I'm going to be talking about the 7 main symptoms of SIBO. Hello, I'm Dr. Mona Morstein. Welcome to my channel. I'm a naturopathic physician of 36 years experience. Today, I'm going to be talking about the 7 main symptoms of SIBO, or small intestinal bacterial overgrowth. If you haven't already, please join my subscription. And now let's dive in. So SIBO, small intestine bacterial overgrowth, is a very common problem. It's a huge percentage of patients who have IBS. How do you know you could be having SIBO? Many people walk around every day with chronic symptoms in their gut that it just doesn't feel right. But what are the key ones that would make you think I could have SIBO? Here's the first one. It's hard, not impossible, but it's hard to not have SIBO without a lot of bloating and distension in the abdomen. And that can be either upper abdomen, above your belly button, or below the belly button in the lower abdomen, or the whole thing. And it's super common when people have SIBO and they report by the end of the day, they look like they're pregnant. Now, that's obviously very discomforting. You may wake up with a flat stomach, but as soon as you start to eat or drink even water, you can then start feeling distended. Some people actually even wake up already distended. But if you're having a chronic problem with this bloating, distension, you want to think, could I have SIBO? The bloating and distension is because SIBO, which are either bacteria or a kind of proto-bacteria called an archaea, they make enormous amounts of gases in your intestinal tract. And that gas sometimes is going to be attempting to leave. And that means that with the bloating, with the distension, you could have a lot of belching as the gas is going up, or you could have a lot of flatulence as the gas is trying to get out downwards. In this situation, although there may be too much belching or there may be too much flatulence, it doesn't really take care of the bloating. So it is not this simple cure for the distension. It's still going on. You're just having the gas on top of it. So if those two things are happening, think SIBO. The third is a lot of food reactions. So SIBO in your intestinal tract eats part of your food and makes gas, but also it can impair the ability for you to make certain enzymes called disaccharidases, which are made in the lining of the small gut. And the SIBO bacteria can interfere with that. So you can start reacting to many of these carbohydrate foods that need a disaccharidase to break down. So people start having many foods, particularly in the carbohydrate group, such as grains and fruits, some veggies, garlic and onions, all of these things. Not so much in generally protein or oil. There's a lot of foods eaten that just cause this bloating and distension and this wholeness and just discomfort. So if you're starting to note that this is happening and now you're narrowing your diet, you're taking this out and you're taking that out and this and that, and now you're just eating a handful of foods every day, that's bad. It's bad for you and your gut and the quality of your life, and you need to think, could I have SIBO? The fourth one is either having constipation or diarrhea. Many SIBO patients have a daily bowel movement, but the kind of bacteria you have can tend to initiate having more diarrhea or can initiate really struggling with constipation. If either these kind of extremes from the normal bowel movement, just 2, 3, 4 bowel movements a day, or watery, loose bowel movements, you're not really having formed bowel movements, or you're just not going to go except every 3 days or 4 days, or you're not going to go at all unless you take something, a laxative, or you're on magnesium or Miralax, or you're on Ducalax, or anything to just have to go. These are also kind of red flags that SIBO could be going on, these kind of changes in your rate of defecation. So think SIBO. The fifth sign or symptom is abdominal pain. Now that may be just because you're having a lot of bloating and distension, and obviously there can be a lot of pressure that doesn't feel good. But there can also be sometimes sharper pains right down here, right up here, that can actually be other pains that people are having, more sharp or dull, outside of just the pressure pain of the bloating and distension, right? So if you start, now you're having abdominal pains on top of these other things, could be SIBO. Another one is GERD or heartburn. So GERD, gastroesophageal reflux disease, and heartburn are very related to each other. But imagine all this gas that you're having. You've got a big balloon inside of you, and it could be like for women, like pregnancy, right, with the baby pressing up. And this gas can be pressing up and causing people to have pretty chronic GERD and heartburn, the burning, the reflux, bad taste in your mouth, the hoarseness, the coughing. All of these signs of GERD could be happening with all this upward pressing gas. The seventh symptom is anxiety. The vagus nerve runs everything in your gut, but it goes from your brain and it runs your gut and your heart. And it's interesting, but when the gut starts really acting up and it doesn't feel good, it seems that one of the biggest emotions that people feel as a result is anxiety. And I think this is already associated with the gut. Think, oh, I'm nervous, I have butterflies in my stomach, right? So the stomach is an area for anxiety. And when the gut is really working up and not working, and of course there could be anxiety, like, what's going on with me? Why do I just have all of these gut problems all the time? Am I ever going to have a normal gut again? Can I ever eat more food again? So there's a lot of anxiety about just having SIBO and the symptoms, but also just the upset gut and the vagus nerve can start producing anxiety. Those are the kind of 7 main symptoms of SIBO. If you're having any of those, now you don't have to have all of them, but if you're having a few of them, you want to find a doc who really knows about SIBO, how to test, how to treat it, follow up, all of that. If you've enjoyed this video, please press the like button and the subscribe button as well. If you want to get my guide on the central ways to eradicate SIBO, just click the link in my description. If you'd like to have a new patient or a complimentary visit with me, please go to my website, Dr. Mona Morstein, and just click on the contact form.